Hello. In this video, we are going to tell you 5 unique and important characteristics of SBHG. You will learn how we are a group of companies. We are excited to let you know about how you can participate in owning this company. And you will learn that we provide a lot of different services and that we have very advanced systems that help the company operate.
Special characteristic number 1, we are actually not one company, but 2 companies. In addition to SBHG, our second company is StarView Children and Family Services. SBHG is a for-profit company and StarView is non-profit. SBHG partners with StarView through providing management services. Some laws or policies allow only for nonprofit organizations to provide certain programs and services, such as child welfare services. StarView Children and Family Services was developed in the 1990s to provide those services.
And while SBHG and StarView Children and Family Services are 2 separate companies that partner together, our second characteristic is that STAR's behavioral health group really is a group. If you're going to work in a corporate department, you're joining as an employee of SBHG. But most staff will be joining one of the many subsidiary companies of SBHG. Why we have these subsidiaries and go by different names is our second unique characteristic. Our main funding is Medi-Cal, California's version of Medicaid, the federal health insurance program for those experiencing poverty or having a low income. In California, the behavioral health services for Medi-Cal recipients are separately managed and organized by each of the state's 58 counties. So we have decided to adopt a different name in each county or region we work in. To reflect that, we are part of each county's behavioral health system. Here are some agency names the counties each serve. Also locations of our corporate headquarters and our regional corporate office. This last one can be a bit confusing. The SBHG subsidiary serving Los Angeles County also has StarView in its name, but it is StarView Behavioral Health, and that is an SBHG subsidiary and therefore distinct from StarView Children and Family Services. Our county partners in LA just know us as StarView.
Our third special characteristic goes back to SBHG being a for-profit company. We are a special kind called an ESOP. An ESOP is an employee stock ownership program. And yes, that means that our employees own shares in the company. In fact, we are a special kind of ESOP, as we are a 100% ESOP. Our employees own the entire company. When we go over the employee benefits, you will learn about the ESOP and how it can build wealth for you and your family. You might be thinking, what about StarView Children and Family Services? It is not in the ESOP, but it has its own special employee benefit, an enhanced 401k program. Again, you will learn more about this when we cover benefits.
You may already have a sense of STAR's fourth special characteristic. It is the diversity of our programs. While most organizations that do the work we do serve one county or do a few programs, we are a statewide organization which provides all types of behavioral health care services. This is called the continuum of care, as many patients will transition from one level of care to another as their needs change. We are going to go through 5 main types of services or levels of care that make up the continuum of care. To serve patients most in need, those experiencing an acute crisis episode that requires the highest level of treatment, we operate hospitals that provide acute inpatient treatment. In California, there is a special type of psychiatric hospital called a psychiatric health facility. That is what we operate. Based on the letters PHF, these are called PUFs.
Next on the continuum are residential treatment programs. These programs provide intensive treatment, but at a lower level than the PUFs. They are an alternative to hospitalization or can be a step down for a patient who has been in the hospital but needs a longer period to recover. We have two types: crisis residential treatment, or CRT facilities, are treatment programs for adults. Our patients stay for a few weeks and we help them transition home or to a longer-term facility. A community treatment facility, or CTF, is a high-level residential treatment program for adolescents. These patients stay several months before they transition home.
Next on the continuum are crisis stabilization programs. These operate as short-term intensive programs to help patients who have experienced a crisis to stabilize and avoid psychiatric hospitalization. The length of stay is limited to 24 hours. Our crisis stabilization programs go by several names shown here. These programs are also an alternative to general hospital emergency rooms, which generally do not specialize in treating mental health crisis.
Our largest programs are those that are next on the continuum, our community service programs. These are outpatient services provided in the community or at our clinic sites. We have a very large array of specialized types of programs. Some work with specific populations such as foster youth or adults involved with a mental health court. We provide services at special community sites such as school campuses, a juvenile probation detention facility, or an adult supportive housing location. We see many patients where they live, be it at home or on the street. And we provide services via telehealth using video conferencing or just over the phone, providing a convenience for patients and families.
Many programs use a team approach, which combines a treatment clinician with a paraprofessional staff. These staff are often peer staff, meaning they have what is called lived experience. This can be through having received mental health or substance abuse treatment, having been homeless or housing insecure, being a victim of human trafficking or domestic violence, or experiencing the foster care or juvenile probation systems as a youth or parent. Peer staff are highly effective in engaging and supporting our patients and families. The team approach is used in our most intensive community service programs, wraparound and full service partnerships. These programs support the highest needs patients.
And our last stop on the continuum of care are prevention and early intervention programs. These programs outreach to specific groups to prevent mental health and addiction issues using community education. They also attempt to identify individuals most at risk using screenings and other approaches. Early intervention services are provided to those individuals first experiencing symptoms to engage them and get them into treatment. These programs also work with patients who have been in care but are resistant to treatment or otherwise not effectively managing their own recovery and well-being. Through care and management, we assist them in getting the help and resources they need. This fourth special characteristic of STARS is the amazing breadth of programs and services we provide all along the continuum of care. We serve all ages and work with individuals, families, schools, other community-based organizations, our county partners, and entire communities to do so.
Okay, are you ready to learn the fifth and final special characteristic of STARS? You have heard how we operate a large organization with a lot of moving parts, and that we are very dedicated to our patients and to you, our employees. To be successful doing all that, we have to have great systems. These operating systems are what also make us special. We are going to tell you about two. First, our Total Quality Management Program. Providing safe and effective patient care is our first priority, and our TQM system was designed to help us do so. We measure and evaluate many things, always with an aim to continuously improve. We have evolved our TQM system over time, and it is now integrated with the standards of the national organization through which we are accredited, the Joint Commission. The Joint Commission, or TJC, is the leading organization that accredits healthcare organizations if they can meet quality of care standards, which we have been doing since first being accredited in 2013.
Second is our array of information systems. We have automated our work processes through implementing sophisticated software systems. And we are increasingly using data to inform our decision-making at all levels, including individual patient care. A sampling of these systems start with our main system is our electronic medical record, our EMR. All staff providing patient care will be trained on its use.
All staff will be trained on our HCM, or Human Capital Management System, through which employee records, payroll, benefits, and all things HR are managed. We utilize an integrated business platform for emails, information processing, video meetings, and document sharing and storage. And lastly, behind the scenes, we have developed a sophisticated business intelligence system through which we provide real-time data on operations and patient care using dashboards available to managers and patient care staff.
Congratulations! You have now completed 2 of the 3 sections of this company overview. You've learned about SBHG's history, mission, and core values, and we have shared 5 things that make STAR special, unique, and a leader in our field of providing behavioral health care and other human services. We have one more thing to share with you in the next video. That is where you fit into all of this.